Erectile dysfunction is the inability to obtain and maintain an erection satisfactory for sexual intercourse. It's a terrible disease process that affects millions of men on a physical, but also on a deeply emotional level. It's a topic that has fascinated me for years. I've dedicated my career to understanding ED and helping my patients get the care they need. I am Dr. Samantha Nealon. I'm a genitourinary, reconstructive surgery, and prosthetics fellow at the University of Texas Southwestern Medical Center in Dallas, Texas. In this series, I'll take you on a journey where we'll meet 5 urologists across the country. We'll learn about the life-changing therapies that are available for erectile dysfunction. These treatments are restoring sexual health and giving hope. My goal is to shed light on a topic that has been in the dark for far too many years and to help more patients get the care that they need. This is hard. Today we're here in St. Louis, Missouri. We'll meet with Dr. Arnold Bullock, who's a distinguished professor of urology at Washington University and a longtime erectile dysfunction surgeon. We'll also meet his patient Cliff, who's had erectile dysfunction for over 15 years after his treatment for prostate cancer. And we'll have the opportunity to learn of a beautiful love story between Cliff and his wife Marilyn, and learn how their journey through the treatment of erectile dysfunction actually brought them closer together.
That's my favorite picture.
Really lovely.
I am married. I'm married 54 years. I don't know what life would be without her. She truly is my soulmate. When I was 58 years old, I ended up with prostate cancer. So I had the prostate removed, and then all of a sudden, I was not able to kind of have erections. I felt like I lost my manhood. I felt like there was a way you're supposed to do things, and I couldn't do it anymore. Like I had failed, you know, in being intimate, and it was devastating.
52% of men between the ages of 40 and 70 have some degree of erectile dysfunction. Unlike presented 40 years ago, that ED was a psychologic disorder, we now know that 90% of men who have erectile dysfunction, it's a physical disorder. Erections occur primarily because there's blood that's encouraged to flow into the penis. So if there's a neurologic injury where the message doesn't get to the penis, then there's no encouragement for the blood to flow. If a person has inadequate cardiac output, person had pelvic surgery, they could have nerve injury, a person with low hormone levels. There are many reasons for erectile dysfunction.
I went to my regular GP, and he said, we'll try these pills. But when they didn't work, I went back to him and did the same thing with the external vacuum device. And when that didn't work, I didn't do anything.
This was another couple that didn't realize that implants even existed. Because most patients only give 2 treatments a try. You really should present implants as your treatment of choice based on the facts. The facts say that it has the highest satisfaction rate. It's the one that most fits into a regular sexual experience, and it's one that people years later are still happy with.
The gentleman that did the prostate surgery for me had a partner who happened to be Dr. Bullock here in St. Louis, and invited us to a discussion on erectile dysfunction. And that's how I finally really learned that it is fixable.
If you're a couple that really are into each other and you're going to be sexually active on a regular basis, there's no therapy that's better than an implant.
It seemed to both of us that really answered the question about being able to have erections again whenever you wanted them.
I guess you have to see men before and after they get treated. And you see that the joy and the satisfaction that they have and how complete and how full they feel by fixing this problem.
It brought back the old Cliff. the Cliff she married. It brought back the intimacy and then some that we had lost. And she stood by me for the whole thing. ED is a terrible thing to face, and the only way you're going to face it is if you own up to it and talk to somebody about it. Because if you keep it to yourself, it's just going to eat you alive. And you don't have to be like that. It can be fixed, and you can have a life, a good life. Love you.
Love you too. Today was fascinating, really eye-opening for me, getting to sit down and talk with Dr. Bullock about his practice. He told me all about how his practice has evolved as it pertains to the devices he uses, the way he counsels patients, and the importance of outreach in our communities. He also continued to reiterate the emotional struggles that these patients go through to even bring up the topic of their erectile dysfunction. Many patients have trouble even bringing up their ED to their most intimate partner, and they're not alone. So many men are struggling with erectile dysfunction and dealing with those same struggles and emotions. I really want to thank Dr. Bullock, and thank you from the bottom of my heart, Cliff and Marilyn, for opening up your home to us and allowing us to come in and hear about your life together and your beautiful love story. Thank you.